We answered the call in 1948 in the face of a community-wide polio epidemic. We answered the call in 1981 as Omaha continued to expand westward. In 2000, when our dedication to children demanded a bold move. And again in 2010, strengthening our place in the community with a dramatic expansion. Can you feel it? The energy and the urgency of another defining moment in our history. A call to dream bigger and take bold action once again. Once a community hospital, now a regional and national academic medical center, embarking on a new era of dramatic transformation and significant growth, eager to build on a reputation for excellence. More than wanting to, having to, because the demand for quality, value-based care is only going to increase, because Children's is often operating at maximum capacity, because we never want to turn a child in need away, because children and their families are counting on us.
I think this is a very special time and a very special place for our community, for our institution, as well as for all the children that we are entrusted to serve. And this is a lifetime that we're affecting, not just a life.
The opportunity before us to build one of the nation's leading epicenters of pediatric healthcare so that we can continue to live our mission, to improve the life of every child for generations to come. Growth projections make it clear. To realize our mission in the future and to meet the needs of families right now, we must grow.
We have children that are leaving our community for specialized healthcare in other children's hospitals. They're going to Denver, Kansas City, Boston, Cincinnati, all places that I know very well. And why is that? Because we have gaps. Those gaps are going to be closed. This institution, just from a size perspective, will double in the next 10 years because of the kinds of services and programs we bring to bear. We're going to bring the right kind of specialists. We're going to have the integrated teams that can care for those children with complex and rare disorders.
This expansion starts at our main campus at 84th and Dodge. This is what evolution looks like, a cutting-edge new addition, the Center for Children. A critical investment that will house Nebraska's only Level 4 neonatal intensive care unit, bringing it closer to our highly skilled pediatric specialists, diagnostic and surgical facilities.
It'll make a huge difference for us to all be together in the same building. Every time we have to bring a baby out of the NICU and across the street to have a procedure or a surgery, it can be very, very stressful for the babies. And sometimes they don't handle that trip very well. So whatever we can do to minimize that stress, in addition to just having ease of access to everyone and the logistical implications, it will be very, very important. We offer access to subspecialists that you can't get anywhere else in the state of Nebraska. And for that reason, we get commonly patients who are referred from Nebraska, Iowa, South Dakota, Missouri, Kansas, who are very, very sick and cannot receive the care or treatments they need in other NICUs. And so that's why it's important for us to be here and to grow as much as we can, because those patients and their families are counting on us.
The center will also be home to an important companion program to our neonatal intensive care unit, the Fetal Care Center. For expectant moms carrying high-risk babies, it provides advanced diagnostic and delivery services, and for those fragile infants, immediate access to Children's team of specialists.
One thing in particular in the neonatal intensive care unit that we are really focused on is expanding care to pregnant mothers whose babies will need some type of intervention or hospitalization shortly after birth. We want to be able to keep those moms and babies together, and we're hoping that with this expansion, we'll be able to provide more labor and delivery services to those mothers so that they can stay here in the hospital with their babies.
Right now, Children's Pediatric Intensive Care Unit cares for the region's sickest, most critical children and teens. Projections indicate patient need will grow 40% by 2025. To accommodate, our expansion will house our Pediatric Intensive Care Unit and space for additional pediatric or neonatal intensive care capabilities.
Well, expansion for the pediatric intensive care unit is vitally important because right now we're running at capacity pretty much every day. The last 3 years here at Children's Hospital and Medical Center, we've seen just an incredible amount of growth as far as the number of kids who need our services. In 2013 and again in 2014 and then last year as well, we actually had the unfortunate circumstance of having to turn away children from the pediatric ICU to other hospitals.
Another promise of our new building? Better outcomes and a better experience for young heart patients and their families. The new home for our cardiac care center, offering the most specialized expertise and technology available, providing medically complex heart patients a lifetime of comprehensive care from infancy to adulthood. Patients like Caitlin Larson. As a baby, Caitlin received a heart transplant at Children's. Now an active toddler, her parents are counting on Children's to be there and to be the best as she grows up.
I feel that it was really a miracle that Children's had a transplant program in place for us. We completely depend on Children's being there for us now and in the future. Caitlin has a complex, very complicated health issue that it's not only right now, but it's a lifetime challenge that she will have and will need lifetime care. And the fact that they have a program that is going to allow her to go there for her life is so comforting for me. Children's has forever changed Caitlin's life as well as our lives. If they weren't there, I know that Caitlin wouldn't be here. And our lives wouldn't look like they do today.
Expansion will double Children's surgical services capacity. The need for more surgical space is acute. Surgery volumes increased by 13% last year alone. More specialties, more complex cases, and a larger regional reach are also driving demand. With 16 operating rooms, Children's will be ready.
Our ORs are full, our floors are full. We're trying to figure out where else we can send these patients. And so it's critical at this time that we invest in our community. I think of how we can make this the best hospital in the country. This gives us that chance. It gives us that chance to really make a difference in not only our community, but really to lead the rest of the country in caring for children.
A larger, more modern emergency department is another exciting element of Children's growth. It will allow more patients to be seen more quickly.
So right now, the emergency department has physical space that was really designed for volumes about 60% of what we're seeing right now. As we continue to grow, that number is going to become more and more stretched. So I envision a future where we have an emergency department that is designed with modern concepts of patient flow dynamics, increased efficiency, pod-based design, for example, that we just currently don't have in our facility. So I envision a future that has new modern facilities, new modern design, that's able to accommodate larger volumes of patients, maybe even more efficiently than we handle the volumes today.
If patients need to be monitored after treatment in the emergency department or after an outpatient surgery, a short-stay observation unit will offer appropriate, cost-effective care for patients who might otherwise be transferred to an inpatient floor. The right care at the right time in the right place. New spaces and enhanced services to complement the exceptional care delivered on Children's current medical surgical floors. And that's only the beginning. The Center for Children will strengthen the 4 pillars behind every great medical institution: clinical care, research, education, and advocacy. With the center, more robust programs and services will be possible. We'll be able to add and enhance programs of national prominence. Programs like osteogenesis imperfecta, which draws patients from across the country and around the world, bringing children like Sydney to Omaha for world-class care. Sydney and her family have been coming to Omaha for Children's internationally recognized expertise for over a decade, developing new and existing programs because children from near and far are counting on us. They're also counting on us for more accessible care. We'll embrace telemedicine and the medical home model to ensure access to quality health care for unserved and underserved children.
We know that telehealth is going to become a very important part of what we do every day. It can really amplify how many lives we can touch in a meaningful way. And so this is a way to really bring our expertise to the home, to the school, to the primary care providers, to those rural communities.
This also means adding more specialists, so no child in need is ever turned away. The center also will support the advanced research needed to take pediatric care to the next level and attract the nation's best caregivers. Our approach is collaborative, working together with valuable local partners to deliver critical breakthroughs. Taking advantage of our current research strengths in pediatrics, we'll focus on 4 key areas of medicine, with the goal of finding new cures and treatments, of improving outcomes, and ultimately, young lives.
The driving force for all the research that's done is really to improve the care of the individual patient. We need to grow new clinical programs, bring new technologies to serve our children, but also expand our ability to perform cutting-edge research, both clinical trials as well as bench and translational work. That's how you grow a national reputation. It takes more than just the expert patient care we have now. We need to think bigger, beyond the bedside and to the whole community.
With eyes ever on the future, Children's has always valued the opportunity to educate the next generation of healthcare professionals. As a proud teaching hospital, new facilities and cutting-edge programs will raise the bar on our ability to prepare future caregivers. When brilliant minds are developed in an environment of innovation, training becomes truly transformative, and our entire community benefits. We've always been a champion for children, but how will we step up to serve them in the years to come? Greater advocacy and community involvement are key. We will advance efforts to promote education, disease and injury prevention, and increase our influence on a broader scale. A dynamic force for good on behalf of the smallest and sickest among us.
We have a very important role in advocacy for children's rights, children's health issues, and healthcare delivery. And that's what we really focus on. We think this is a very, very important pillar of what we do.
Connected physically and integrated architecturally, our new Center for Children will stand between the hospital and our specialty pediatric center. In what can best be called an aligning of the stars, we are capitalizing on an incredible opportunity with the acquisition of adjacent property for nearby office and additional research space. Our vision radiates beyond 84th and Dodge, stretching to all corners of the heartland. We will serve more families in West Omaha with our outpatient surgery center, sports physical therapy, rehab and specialty clinics, and an outpatient destination center. Our primary care network is growing across the metro area as well, adding more providers and moving existing offices into other facilities to accommodate increasing demand. We're also evaluating additional locations that will allow us to better serve unmet needs across Omaha, Lincoln, and Iowa.
We've been expanding a lot over the last few years, and we're finding as we open up new offices, people want our services. I think for years, people maybe went to other places just because it was easier for them. There's areas of both Nebraska and Iowa that were underserved from our perspective. Now that we've, for example, opened up in Council Bluffs this year, that clinic has just gone crazy. It's busy, the patients love it, the families love it.
Can you feel it? We are being called to be dreamers and doers, community champions and partners in translating vision to reality, allowing us to serve more and serve better.
It's much more than a building. It's about our community. And when I define community, it's not just the community we live in, it's our broader community in the heartland. And we have an obligation not only to serve our urban community, but really a much broader community. There are children in rural Nebraska, in South Dakota, in Iowa that need access to our expertise and our systems and our people.
A vision that will forever transform Children's Hospital and Medical Center, funded by our own financial reserves and the generous benefactors who've put children first again and again, decade after decade.
I'm very excited about children's future for several reasons. First of all, the hospital is in a strong financial condition. We have a wonderful medical staff, and the entire staff of Children's is outstanding. The children in our community will be well taken care of, and in order to continue to provide that service, pediatric health, we need the support of the community.
Changing lives together. It's what we do, and it's what we're calling our new capital campaign, a 5-year, $50 million effort that will help support this critically important campus expansion project and fuel children's research efforts.
Investing in children's and the expansion, what better way to give and to serve the community, because it draws so many people in and it's changing lives.
What we're creating is ambitious, but it's the why that really matters. An unwavering belief that families deserve a greater depth and breadth of pediatric services and the highest value care closer to home. That a strong children's hospital will draw expertise from around the country, and that new facilities will allow our education and research efforts to flourish.
This expansion is transformative for children's. It's really taking us to the major leagues in terms of children's hospitals. When I think about the genetic services that we're going to be able to provide over the next 10 years, it's extremely exciting. We're talking about targeted therapeutic clinics. We're talking about precision medicine for children. That's going to be reality. And there is no reason why we shouldn't be providing that high level of care at the cutting edge here at Children's Hospital and Medical Center.
We have the momentum, the power, and the will. And together, we will improve the overall health status of children on a larger scale, changing and saving more young lives, elevate our standing nationally and globally, and reach our full potential so future generations can reach theirs.
We want to be pushed. We are excited about pushing our skills, pushing our program, pushing our personnel to new limits, and I think we want to do that locally, regionally, nationally. And so what we want is to have the best program, not that we can be, but to have the best program, period, so that we can do the best that we can for as many as we can. It's an investment in the future of our children, and it's creating a legacy of your own through the care of kids who are in need. And I can think of no greater challenge and no greater responsibility than to ensure the care of kids.
Throughout our history, we've weighed risk and seized opportunity, soaring with ambition, but staying grounded in our mission. To improve the life of every child. The best place for kids, continually moving from great to greater. Committed to a bold future with resolve, optimism, and a strong sense of responsibility. Because the children and families we serve deserve nothing less.